this video, we're going to give a demonstration on how to give your cat or dog fluids underneath the skin. So with human medicine, it's pretty difficult to give people subcutaneous fluids, but it's very common in pets because it's a much easier way for us to give a larger volume that lasts them a longer period of time. And they have this really nice area of scruff that gives us an area to put those fluids. Fluids can be really beneficial for cats with certain types of diseases or illnesses. So a lot of times if pet owners are able to give them at home, that can be really beneficial for their treatment. So when you're starting with some fluids, if we have a pet that we are starting on fluids, we typically send them home with a bag of the fluids, as well as an extension set that is spiked into the bag. Every time you give your subcutaneous fluids, you'll want to make sure that you are using a new needle. If you ever need any additional needles for your pet, you can always reach out and let us know. So we're just switching on and locking on a new needle. Now, if you do have a kitty that is food motivated, a lot of times leaving them a little bit of a snack or doing this during mealtime can make it a more pleasant experience for them. Luna's not a huge fan of her treats, so she probably will be just fine being more excited to get it over with. So you'll take your fluids and your needle, and you'll first want to start by making a skin tent. And so you'll see how her stretchy skin kind of raises away from her body, and it's all of this empty space that's where we're going to be wanting to put her fluids. I usually like to take my finger and kind of come into the V from this direction to avoid poking through and then having the fluids go out the other side. So I kind of plan for where I'm going to put my needle, and then we're going to want to make sure we're putting it perpendicular to her back. And you can see that we're not putting the needle anywhere into her body. It is just going underneath the skin. So for this reason, we don't want to be aiming the needle down. We will just be aiming it backwards. Once you open your needle, again, and just verifying the spot, you'll do a quick poke. Very good. And that is all. Once your needle is in, the kitty usually relaxes and feels a lot better about that being done. That's the hardest part. From here, you can either hang your bag, or if you have a friend at home that's able to hold your bag, you open up your fluid line. This is just the little stopper, and then you'll watch it flow. So you can see the little drips down here showing that it's coming out of the bag. Drip, drip, drip. And sometimes if you know how much you need to give, you can even just give the bag a little squeeze to make it flow faster. And then you'll be watching these numbers on the side of the bag to know how much fluids that you're giving. So a lot of cats, for example, are given either between 100 to 200 milliliters of fluids per time. And so between each number is 100. So if we started at around the 4 for Miss Luna, 100 would be at the 5, 150 would be between the 5 and the 6, for example. So that is how we would give the fluids. Again, if we feel that it's going too slow, sometimes we can even just reposition the needle a little bit to make sure it's in that good open space underneath the skin. For example, there we go, we move it and now it's dripping a lot better. Very good. Once we've reached our end point, or to the point where we're finished giving them the fluids, we use the stopper to stop the flow of the fluid. You can see my drop stopped to show that the line is blocked. And then we simply remove the needle. Now sometimes a little bit of the fluid can leak out, and that is okay. That will stop very quickly after pulling. We'll just hold a little bit of pressure. Very good, Miss Luna. We want to make sure that we're recapping our needle carefully so we don't accidentally poke ourselves. Good. And after you give fluids, you might notice a little hump or lump underneath the skin. And that's good. That's where all of that fluid went into the pet. And over time, that will redistribute and move. So I like to refer to it as their little camel hump because they'll carry that fluid along with them, and it's usually absorbed over about 24 hours. So Luna was a very good patient in showing us how you would give fluids at home, but certainly reach out if you have any questions or need any assistance with helping your own pet.